أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. My dear students, fellows and friends and physicians who are appearing in the membership examinations or in the fellowship examinations, whether in the country or outside the country. I am Professor C.JUJNI. I am honorary global professor of medicine without seeking any aim, name, fame or economics. Today's topic, I am actually continuing my infectiology, that's infection and the disease. Although it is a dry subject, but you have to learn it. Otherwise you cannot understand many of the things. Campylobacter C.JUJNI. One time it was regarded as commensal, but now it is regarded as the organism of pathological importance. Introduction: it is a gram-negative bacilli and it is one of the causes of the food poisoning, often neglected in differential diagnosis. It is often neglected. So incidence is there in the United States. Each year about 100,000 people are affected. 20 new cases are diagnosed, and every 100,000 people, 20 cases are reported, while many more cases are undiagnosed and unreported, because if you add this, it will 30%, 30 cases or 40 cases per 100,000 people. The CDC estimates a total of 1.5 million infections every year. The European Food Safety Authority reported the death rate is 246,571 in 2018, and estimated approximately 9 million cases of human campylobacteriosis per year in the European Union. This is seen in the Europe and in the United States, where they diagnose it correctly. In Pakistan, its problem is that it is zoonotic disease. It is zoonotic disease mainly because this bacteria is flourished in the meat, milk and other food commodities in Pakistan. So the study was done in which total of 1636 food samples of the meat, milk and other food commodities were procured from the three big cities of the Pakistan, Faisalabad, Lahore, Islamabad. Campylobacter was recorded in a raw chicken meat. जिसके सब शौकीन होते हैं. Raw chicken meat followed by the raw beef, and it is 10.9%, and the raw mutton in 5.1%. So the prevalence, highest prevalence were recorded in the chicken meat rather than in the raw mutton. Among the other food commodities, the highest prevalence was observed in the vegetable fruit salad, 40 to 90%. Salads are usually served, they are contaminated in the restaurant and hotels, sandwiches, cheese, and the raw bulk milk samples also. The overall prevalence of the Campylobacter C.JUJNI was found in 21.5%, out of which the 70.6% were identified as Campylobacter C.JUJNI. The other variant is Campylobacter coli, 29.4%. The study reported that the prevalence of the Campylobacter species was significantly higher in the food commodities, which included the raw and undercooked ingredients. Now it is very important that if you are dealing with a food poisoning, you should understand what type of the food he was taking since how many hours before. And this is a very important question because it will decide the incubation period. The second thing you have to decide, it is a small bowel diarrhea or the large bowel diarrhea. It is actually the large bowel diarrhea, not the small bowel diarrhea, first of all. Secondly, if the diarrhea, which was definitely watery motions, and it is associated with hematochezia, that is blood in the stool, try to include your diagnosis with Campylobacter C.JUJNI. This is very, very important to understand. Microbiology that is of this importance, this is the curved rod. It is gram negative, and it is the reservoir of infection is in poultry, and the feces and the helical-shaped, non-spore-forming, gram-negative, microphilic, non-fermenting, motile bacteria. This is another important point regarding the microbiology is concerned to differentiate with the other bacteria. The species of the pathological bacteria are one of the most common causes of human gastroenteritis in the world, as the whole world is concerned, because they are very fond of taking the cheese burger and the mutton burger and farah burger or farah burger, club sandwiches. This type of the food poisoning is the commonest, one of the commonest. Not in our country because we underdiagnosed. The condition is underdiagnosed, so we do not consider it. Association is of this. It may be possibility that it will lead to lead to the Guillain-Barré syndrome. May be associated with it. It may be related. It is also one of the association is with the reactive arthritis. It may be associated with the reactive arthritis, and it is also the person has got HLA-B27, that is seronegative type of the spondyloarthritis is also associated. The three associations are important and can be asked in the examination. If there is a chronic diarrhea and the examiner is taking you to the acute diarrhea, and the patient has described that he has got pain in the joints, and he's seen the inflammatory joints, signs of the inflammation in the joints, then this condition may be associated. Secondly, it may cause the low back pain associated with the diarrhea, again after 1 week or 2 weeks. It may be associated with this also. That is ankylosing spondylitis. Sex, they are frequently associated in the males and females, and homosexual men appear to have higher risk of infection by atypical Campylobacter species as Helicobacter senali and Helicobacter phenoli. So these infections are also important in case of immunosuppression like HIV. Age, it may occur in the younger age, it may occur in the middle age, it may occur in the old age. The risk factor again, the end of the life, that is the neonates and the very old persons. They are high risk, and those who are diabetics, those who are immunosuppressed, and those who are taking the steroids. The reservoir of infection in this case is the poultry. I already mentioned out. Products of the poultry, it may occur via eggs also, and is also found in the digestive tract of many bird species. So those persons who are fond of the shikar, that is going for the hunting purposes, and they fire the birds and they eat the birds bulk, it is possible that they are colonized with this bacteria. Other than the feces, other than the other contaminated water is possibility, and the common items of fast foods are also associated as a reservoir of infection. Another infection is raw milk is also source of infection. The people are fond of raw milk. In the rural area, you can see that they are squeezing the mammary glands of the buffaloes, and they are taking directly into the inside. So they said that this is a pure milk and it is good for their health. If it is the cattle is infected, it means that this infection will cause as a jejunal infection, Campylobacter jejunal infection, and it will cause much problems. Now here it is seen that it is actually the pathogenesis that the organism to cause the disease is that from the ingestion of contaminated food or water first, an infective dose can be dosed at 800 organisms only. To initiate infection, the organism must penetrate the gastrointestinal mucus. It does using its high motility and spiral shaped. just like screwing inside. The bacteria must then adhere to the gut enterocytes and can then induce diarrhea by toxin releasing properties. And Campylobacter jejuni releases several different toxins, mainly enterotoxin and cytotoxin, which vary from the strain to strain and correlate with the severity of the enteritis. The clinical presentation, again the diarrhea, again other than that, the local complication of the infection, it can spread to involve as cholecystitis, pancreatitis, peritonitis. Hemorrhage is the most important complication. Hematochezia. It can cause the chain of the infection, that is the bacteremia, septicemia, pyemia, and the MODS, etc., etc. Now, serious systemic illness can occur when there is septicemia, septic shock. It may lead to the involvement of the other parts of the body. Liver can be involved, the kidney can be involved, the brain can be involved. This is the rule of the infective process. Association I already discussed. Diagnosis can only be made via stool culture, enzyme immunoassay or PCR, which are lacking in this country. PCR for the Campylobacter jejuni. Enzyme immunoassay is available in some of the labs. Stool culture is available, although. So it may be, in some cases, I will do the diagnosis of exclusion. The selective culture techniques are used in the stool culture to isolate the Campylobacter jejuni, but remember, the stool should be fresh. Treatment, yes, it is a gram-negative organism. So what we will give for the gram-negative organism should be given to here, other than the fluid balance, the electrolyte balance, the acid-base balance, already mentioned out in my previous lectures. But you use the specific antibiotics. In this case, condition are the fluoroquinones. You can use the macrolides, and you can use the amoxicillin clavonic acid. Furosemide is also effective in this condition. Prevention, that's simple. Some simple food handling practices, hand washing techniques. And the people, they are not hygienic people who are cooking. So the cooking experts or the head of the department of the kitchen and also of the chickens should be aware of that. The examination should be done before it was cooked, and the hand washing with the soap is properly done. Avoid to go outside and in front of taking the junk foods and the fast foods. Do not drink unpasteurized milk and untreated surfaces. It should be, completely boiled water more than 130 degrees Fahrenheit for 5 minutes. Make sure that the people with diarrhea, especially children, wash their hands carefully, otherwise auto-infection will occur. Wash hands with a soap after contact with the pet feces, specifically those who are fond of the pets, like for example the cats and the dogs and the other birds which are treated as pets in the homes. They should touch the area. If they have touched that area, they thoroughly wash the hands with the soap. Now this is the small presentation, but it is very important that this Campylobacter jejuni should be included in the differential diagnosis of acute gastroenterocolitis. This is the message which I want to give. So, wama alayna illa al-balagh. Assalamu alaikum wa rahmatullahi wa barakatuh.